Objectives. At the end of the lesson, you should be able to 1. Describe the parts and the functions of the heart. 2. Explain how the parts of the heart work together to make the body function properly. 3. Name the different diseases that affect the heart. 4. Show proper care for the heart. 5. Practice habits to maintain a healthy heart. Lightly place 2 fingers on one of your wrists. Breathe slowly and try to focus on what your finger feels. Can you feel a thumping regular movement or beat? Do you know what organ makes this regular thumping or beating movement? Correct. It is your heart. The pulse or heartbeat is the movement that you feel in your body whenever your heart pumps blood. The pulse or pulse rate is also the number of your heartbeats for every minute or 60 seconds. The heart and its functions. Your heart is muscle organ placed almost near the center of your chest. It is almost of the same size as your fist. Like your other muscles, the heart performs a special movement. Its task is to continuously pump blood. Every minute, your heart pumps about 5 to 6 liters of blood to your body. The heart performs 2 main blood pumping tasks. 1. To pump blood from the heart to different parts of the body. 2. To pump deoxygenated blood to the lungs. Blood coming from the heart, called oxygenated blood, goes to the different body parts to give them oxygen and collect wastes like carbon dioxide. It becomes deoxygenated blood and returns to the heart. The heart then pumps it so it can go to the lungs to leave carbon dioxide and collect oxygen. Parts of the heart working together. The different parts of the heart help perform its tasks. It has major blood vessels that bring blood toward and away from the heart. It has chambers that receive blood and perform the pumping action. It has valves that keep the direction of blood flow inside the heart. Major blood vessels. The roads of the blood. Veins are the blood vessels that carry blood toward the heart. Arteries are the blood vessels that carry blood away from the heart. There are 5 important blood vessels attached to the heart. 1. Superior vena cava is the vein that carries blood from your upper body. 2. Inferior vena cava is the vein that carries blood from your lower body. 3. Aorta is the artery that carries blood away from your heart to the rest of your body. 4. Pulmonary artery is the artery that carries blood away from your heart to your lungs. 5. Pulmonary vein is the vein that carries blood from your lungs to your heart. Chambers. The receiver and the pump. The heart has 4 chambers that interact with the major blood vessels. The right and left atria are the upper chambers that receive blood from the veins. The right and left ventricles are the lower chambers that pump blood out of the heart through the arteries. Valves. The gatekeepers. The valves of the heart keep the correct blood flow in the heart. The blood should only flow forward to the next part of the heart. They prevent the blood from flowing backward. There are 4 valves in the heart. The tricuspid valve, pulmonary valve, mitral, bicuspid, valve, and aortic valve. When you follow the flow of blood as each part of the heart performs their tasks, you will learn the step-by-step process on how the heart does its pumping task. 1. Deoxygenated blood from the other parts of your body enters your heart through the superior and inferior vena cava. The right atrium receives deoxygenated blood. 2. The tricuspid valve opens to allow deoxygenated blood to flow from the right atrium to the right ventricle. 3. Then the right ventricle pumps deoxygenated blood to the pulmonary artery. The pulmonary valve also opens to allow the blood to flow to the pulmonary artery and lungs. 4. Oxygenated blood from your lungs enter your heart through the pulmonary vein. The left atrium receives oxygenated blood. 5. The mitral valve opens to allow oxygenated blood to flow from the left atrium to the left ventricle. 6. The left ventricle pumps oxygenated blood to the aorta. The aortic valve also opens to allow the blood to flow to the aorta and other parts of the body. Like other parts of the body, the heart also needs nutrients and care. Here are some ways of taking care of your heart. 1. Eat the right kind of food with more fresh fruits and vegetables. 2. Avoid junk foods and drinks. 3. Do regular physical activities or exercises. Exercise strengthens the heart muscles and improves your blood flow. Ailments of the heart. There are conditions or diseases that affect the functions of the heart. These conditions could affect older and young people alike. Among these conditions are congestive heart failure and arrhythmias. Arrhythmia. It is a condition wherein the heart does not beat in a normal way. It beats too fast, too slow, or the heartbeat has irregular gaps. Congestive heart failure, CHF. In this condition, the heart does not pump and supply the normal amount of blood that your body needs. Heart problems can happen across ages. Problems with the formation of the heart muscle from birth may lead to heart ailments. We call these conditions congenital heart diseases. Practicing unhealthy lifestyle and not taking care of oneself physically, mentally, and emotionally can lead to heart problems. The adults and the elderly often experience these heart conditions. A cardiologist can help you identify your heart condition and give you ways to take care of yourself. Immediately consult a cardiologist if you or a family member experience the following: frequent tiredness and dizziness, breathing difficulty, fainting spells, noticing fluid buildup in the lower body, around stomach or neck. Practice exercise. Answer the following questions. What do you call a muscular organ about the size of your fist? Heart. What will happen if the heart fails to pump blood? Blood will not flow around the body. The different body parts will not get the nutrients and oxygen they need and may be poisoned by the uncollected waste materials. What are the 4 chambers of the heart? Right and left atria and the right and left ventricles. What do you call the part that receives blood flowing from the veins? Atrium. What do you call the part that pumps blood into the arteries? Ventricle.